Hi, I'm Kyla Bauer. I have worked for 5 different startups and run 2 of my own businesses. I've been a freelancer. Apparently by 2020, 50% of the working population is going to be people like me. But if you've ever been injured or sick, you get really jealous of your friends who work for established organizations or large corporations, and they have really cush health benefits, because when you are working on your own, not only is it hard to run your own business, but you are on your own with the healthcare system, and it can be a real nightmare if you don't know the right people. I have created this series to help people in your shoes. More than likely, you won't want to know about it until you're injured or sick, so we'll just take that with a grain of salt. However, I know this problem very well because I have worked for a startup where our main priority was to educate and advocate for individual patients when they're facing challenges, not with their own health, but with the healthcare system, meaning their insurance or the medical bills that they have to pay. And a large majority of the people who reached out for help were small business owners and freelancers. Because the reality is, since I've been working in the healthcare industry, there are not a lot of experts or companies that are even considering trying to help out this population of people who are running their own businesses or are just planning on staying a freelancer or a small business, because we don't have a lot of extra cash flow to send them for their advice or support. And so what I'm going to do is, in the last 7 years that I've worked in the healthcare industry, I've met a lot of passionate people who are trying to change things for the better, and it will actually impact people like us so that we can get better healthcare. So I'm going to try to be interviewing some of these people I've met, passionate primary care physicians and insurance brokers and healthcare attorneys, and even professional patients, people who have been sick for a long time and know the healthcare system so well because they have to go there month after month after month. And I'll be trying to condense that all down into something that's very easy and simple to understand, just so that you know my background. Like I said, I've worked for 5 different startups. I've run 2 of my own businesses. A long time ago, I was actually a published research author. And I've managed 2 hospital programs, an executive wellness program and the brain and body exam with Cleveland Clinic and the NFL Players Association. And there's a lot of other stuff behind there that I'm not going to bother with. Feel free to check out my LinkedIn page if you want to know more. But anyways, peace out. Subscribe to this channel if you want to know more, and I truly hope that it helps you as you're figuring things out so that you can feel supported when you get sick or injured. All right, thank you.